Hello, Professor Wanyenze. Thank you so much for joining us and agreeing to do this interview.
Thank you for the opportunity to speak with you, Josephine, and to our communities out there.
All right. What's it like for you with the situation we're going through? How are you handling it? How are you dealing with it as an individual before we even start to talk about the public health issues around it?
That's a good question, Josephine. COVID is something that I've taken personally beyond the public health because I watch TV, I see every message I get on social media these days is about COVID. I don't like the scenes that I see in Europe, in America. People are sick, people are suffering, people are losing their loved ones.
That's true.
I see the morgues full. So I have taken it personally and I feel I want to do all it takes to be able to make a contribution to protecting Ugandans.
Well, we're so
And of
grateful.
course, protecting myself and my
Yes.
family.
Yes.
Yeah.
We're so glad for people like you who are thinking like that. I know that we've been emphasizing social distancing in Uganda and anyway, generally in the world, but I wanted to hear it from you. What does social distance actually mean? What does it look like? And I know there are different forms of it. So could you just run us through that?
Social distancing comes in several forms, Josephine. There's what you do as an individual, but there's also social distancing at institutional or even at a national level, and it's given different names. The lockdown, for example, that we have in Uganda and in several countries in Africa and around the world is also a form of social distancing in a way. It keeps us away from one another within the workplace, within the market, and all across the world. At individual level, the social distancing is intended to keep you within a distance where if somebody is infected and they sneeze or they cough, the aerosols that transmit the coronavirus do not get to you as a person. If you're seated in a meeting and someone sneezes all of a sudden, and it's based on the science and trying to measure how far do the aerosols that transmit the virus actually go. So currently the recommendations is at least 2 meters. That's what we see from the messages that we are getting from the Ministry of Health. And we also see this in other messages around the world. For example, in the US, the CDC guidelines also do recommend 2 meters. So a distance of at least 2 meters, is good to keep apart from somebody. When they sneeze and you're too close, the aerosols can actually go directly onto your mouth or even your eyes. And that then gains entry into the body.
So what they're asking us to do is to do your own personal social distancing from the people around you, but also with this lockdown, just socially distance from everybody.
Sure, you socially distance from everybody except the people that you live with in your household. Unfortunately, I think one of the issues we are struggling with is compliance. People are not going to work, they are not driving around, but then they've taken to running around in the evenings, very early in the morning, and you see so many people shoulder to shoulder out there. You don't know who you're running close to. And then you go to the supermarkets and you actually also find people queuing up and they are very close to one another. And that is really challenging. So we need to do something about this. We need to commend those that have tried to give us some guidance. For example, I went to the C&A pharmacy over the weekend, and I found they have made some marks on the floor, some circles where you're supposed to stand, so that you keep some distance away from other people within the pharmacy. But unfortunately, people are not complying again. They basically just skip over the circle, and then they are again standing shoulder to shoulder with the next person in the queue. So we need a lot of information out there to mobilize the communities to know that this is really, really crucial in terms of preventing corona. But obviously also knowing that social distancing alone might not be sufficient, because we might have contaminated surfaces around us, doorknobs, it might be your phone. So we need to be able to couple the social distancing with other prevention measures. Hand washing, the cough etiquette, and being able to periodically also disinfect the surfaces that are commonly used. around us, the tables that we have in meeting rooms, the doorknobs. Sometimes we forget the phone. And for you, the journalist, there's the microphone.
Yes,
So
all our
sometimes we
tools.
move around with it. and everybody touches that microphone and you wash your hands and you feel safe. But actually, that too can carry the virus. Yeah,
Right.
so we need to also take on other measures. And of course, the toughest is not touching our eyes, our nose, and
That's
our
so
mouth,
difficult.
because
It seems that all of a sudden, when they told us not to touch our faces, we're all itching to touch our faces.
absolutely, you basically all the time keep touching your face, and I'm just hoping I won't touch mine before we are done with this interview, Joseph. So I'm still also struggling to adjust to the new normal.
Yeah. I was speaking to a couple of people, and I find that a lot of people who are, and I was speaking to someone earlier who was saying the elite will be our undoing. It just seems to people that it's just the flu. It's just the flu. Why we've battled bigger things than this, where we all running around scared about something as small as this. And I know that by virtue of your office and what you do, your profession, essential services really, that you have a wider scope of this and you have an insight to things that maybe we don't understand. How do you speak to people to help them understand that this is serious and it is really, really serious?
This is really, really serious, Josephine. Just about a month ago, we were all debating Africans being immune, and this was trending on all social media platforms. People were writing about this. Africans are immune. There's a speculation around malaria protecting us and so many other things, but we are certainly not immune. Within less than a month, we are almost closing in on 7,000 corona cases in Africa. And you know, after the first cases, the pace is actually much, much faster. If you look at the statement from WHO office in Afro, it's taken us about 2 days to move from 2,000 cases to 3,000 cases in Africa, and it's actually accelerating. It was slower at the onset when we had a few cases with a handful of countries in Africa. As of yesterday, every country in Africa has COVID cases, except Lesotho, that might also probably be coming on board. I haven't checked this morning, but we are all affected now. The numbers are building up. In South Africa, it's more than 1,500. So looking at Uganda with 54 cases, 52 cases 52. Now, we should not underestimate the burden of COVID. The key issue with COVID is the build-up of the numbers that is so rapid. These numbers build up, and they are so many our healthcare system cannot handle. We've seen this in Italy and Spain. We've seen it in US, especially in New York. So once the numbers build up, even when the illness might not be so severe for the majority, the few that need healthcare, we just can't cope. And if we can't cope, then people begin to die. So I think all of us need to work towards making sure that we are not one of those numbers. Our loved ones within our family, the people that we work with, are not part of those numbers, and that we can seriously stop the buildup of the cases of COVID. Once they build up, the system collapses. And once the system collapses, people begin to die of COVID, but people also begin to die of other illnesses. Let's not forget, we also have people with HIV in Uganda estimated at 1.4 million. We have people with TB, we have people with malaria, we have women who still need to access services to deliver, children who need to be immunized, and all the other conditions. So with all the cases building up with COVID, our system cannot cope. And we all have a responsibility to make sure that we stop the spread of COVID, we stop the buildup of numbers, so that we can preserve our health systems and save Ugandans.
All right. Well, I think we've had quite a number of conversations about before COVID comes, and now COVID is here, but it has not touched us as individuals. But I guess now the questions that start to come up are, the numbers are increasing. What if I get it? What then? What happens next?
Actually, the numbers could be more, Josephine. That's what we need to remember, because the data we see from other countries shows that anywhere between 30 to 50% of people that are infected with COVID don't actually show any signs and symptoms at all. So a person that you think is still safe might actually be infected, and that person then is capable of infecting you. And we also know that a significant proportion of them begin to actually infect other people even before the symptoms come on, even before the fever or the cough. Somebody who is infected with COVID is still capable of transmitting. So that's what makes it difficult, and that's why we think the numbers could actually be underestimated even around the world, because without wide testing, we cannot pick those that are asymptomatic, those that don't have symptoms, but they actually have the infection and they are capable of transmitting this to others. So we need to be very careful. The numbers probably might be much larger than we know across the world. And even here in Uganda, when it takes root, if it does, I hope it doesn't, but it becomes very difficult to know who is infected and who is not. And that's why we have to be very careful. We have to assume that we might be infected and that anybody that we interact with might also be infected.
So if I get infected, Professor Anyeze, what next? What do I do?
So if you get infected, so first of all, we need to be equipped with the information. What are the signs and symptoms? You have to be able to detect the signs and symptoms. The most common is fever in about 90% of cases from the global literature, and we are seeing that here in Uganda as well. There's also cough. About 70% of people may develop a cough, but the cough then comes in sometimes later after you've manifested a fever for some time, and then comes other flu-like symptoms. Not everybody with COVID manifests with those flu-like symptoms. So we might not even be suspicious, but when you hike temperatures in this COVID season, the temperatures are not coming down, then you begin to have other signs and symptoms like cough, flu-like symptoms, and some people are beginning to also document the eyes, also being affected. Then you need to ask for help. There are numbers that Ministry of Health has been widely circulating, and we need to call and ask for help. We need to be able to reach out to the health workers to guide us on the next steps. While we do that, then we have to take responsibility to make sure that we are not circulating and interacting with people. And that's why we've been emphasizing that you stay at home, because it's not good for other people around you. It's not good for you to continue interacting and transmitting this infection to others. And then you also need to call very quickly so that you can get help to improve your own health. Yeah.
Right. Well, you mentioned earlier something about testing and mass testing. I would like to hear your thoughts on that for Uganda. What do you think about mass testing?
So mass testing has been a challenge for many countries around the world, like we've seen over the news. Even the US is struggling with having just enough test kits. Some countries have been able to come up with alternative testing kits and have been able to do this a bit more massively, like in China and other Asian countries. But we can't afford to do a testing for everybody. We can't come test you, Josephine, when you're up and doing well. Neither should I be going to test. So because of the limitations, and we had the other time when the president spoke to us, if it's going to cost $65 to test one person, you can't just go out there, test everyone. So the Ministry of Health does have a criteria on who should be tested. People that are suspected to have either because of travel, the exposure, the contacts of the people that have traveled and tested positive, and also other contacts within the community. So we do have what we call an algorithm, or a kind of criteria that the ministry then uses to decide who will be tested and who will not be tested. So once you seek help and you get into the hands of the Ministry of Health officials and the health workers, they do know this criteria. They will manage you and they will support you, and when it's the right time to test, then you'll be tested.
All right. And before I let you go, Professor, my very last question to you, or just my thoughts really. There are all of these people that came aboard this flight, and they got in contact with the public, and there's been this cry, please come out, please come out. But people are not coming out. Is it that they're afraid? Is it that they genuinely feel they don't have the virus? What would you say to them?
What I would say to them is, please do come out. It's good for your own health, because you need to be screened. If you have corona virus, then you can be supported, you can be treated earlier. But also it's good to protect the loved ones, because you might think you have it, or or you don't have it, but then we know that half of the people that have it don't manifest symptoms. So you might actually be transmitting to the people immediately around you. You might do well with it, but they might not make it. So it's our responsibility to protect them by stepping out so that we can be screened and tested if that is needed, so that we can protect people around us. But now we are also getting to a point where we are going beyond the people that traveled, because the people that traveled and were not quarantined immediately have also been in contact with other people. So if you have also been in contact with somebody that has traveled from these countries and from some of the flights that the ministry has been calling up, it's also important that we also step out and be able to help the process, to be able to track, test, and be able to stop the infection from continuing to spread in Uganda.
Well, thank you so much, Professor. Do you have any final words for us before I end this call?
My final word is that it's everyone's responsibility to stop corona. Transmission of an infection is like a relay. You got to get the baton and pass it on to someone else for that chain to continue. Let's break the chain. Let's be part of that process, and let's protect Uganda.
All right. Thank you so much, Professor, for taking the time to speak with us.
Thank you, Josephine.
All right.
Okay.